My pleasure to share a very brief overview of the story of Tooele and how we have started this process here and where we're at today. And I'd like to start out by emphasizing that the Communities That Care process is data-driven, and it's hinged on community mobilization and collaboration. There we are. Thank you. Next slide, please. So by these graphs, you can see that Tooele's rates were concerning, and especially when compared to the rates across the state of Utah. The community had to ask itself why. Some speculations and attempts to explain were that Tooele is a rural community with the perception that there's nothing to do here. Tooele is also closely located to a large urban area where many families may live in Tooele, but they commute to Salt Lake City for work and recreation, creating what has been labeled a bedroom community. This dynamic created several risk factors, such as low neighborhood attachment and community disorganization, transitions and mobility. Another speculation was that many of Tooele's resources and programs were working in silos. Next slide, please. As you can see here by these graphs, that our rates improved greatly once CTC had been implemented and in use for a few years. Not only did our numbers decrease in comparison to ourselves before CTC, but we were closing the gap between us and the rates across the state. Along with seeing decreases in substance use, we were also seeing decreases in other areas, such as rebelliousness, low commitment to school, and family conflict, family management problems. Next slide. As mentioned prior, Tooele was chosen as one of the sites for the Community Youth Development Study. In order to implement CTC effectively and build capacity, several influential players need to become supportive and part of our process. We started out by recruiting champions in our community. We have 3, our mayor, chief of police, and the superintendent of schools. We also approached and educated several key leaders, which included local business owners, educators, parents, members of the medical community, our health department, different levels of government, as well as juvenile justice. From there, our coalition was formed, comprised of folks who represented these different sectors. We also kept in the forefront the essential need for data, current, accurate data. Work groups set out gathering community data, as well as our local student survey data. After compiling all of the information, the assessment of what our needs were began to emerge. We were able to determine which elevated risk factors and depressed protective factors were going to be our focus. Once we determined these targets, we set out gathering information on existing resources. And from that community assessment, we were able to identify gaps in services, education processes, and programming. Next slide. The next step was selecting our evidence-based programs to address our priority factors. This is done through a meeting of minds with key leaders and coalition members. The CTC Prevention Strategies Guide was used as a menu for selection. The programs in this guide are supported by the National Registry of Evidence-Based Programs and Practices. During this phase of the CTC work, we came across some pushback from one of our champions, our chief of police. You see, we've been teaching DARE here in Tooele for over 15 years, and we were very attached to this program. However, our committee proposed to replace it with one of the selected programs, which is the Lions Quest Skills for Adolescents. The chief was not in favor of this change. He was, however, open to what the committee was proposing, and so we took a lot of time to consider this change. He made a list of key points in the DARE program and compared them side by side to key points in the Lions Quest curriculum. He found the Lions Quest program to be much more comprehensive and in-depth. One of the biggest selling points for him was the Lions Quest program was involved throughout the school year and wasn't a standalone program the way the DARE curriculum was being delivered. This process is iterative. We review the programs and practices we're using every 2 years. Next slide. All of the programs we use are comprehensive in the sense that they teach various skill sets and provide information on several topics. Life skills training includes lessons on refusal skills, social skills, learning the difference between being assertive or aggressive, how the media influences us, health effects, peer pressure, and so on. There's great support from the administration of our school district in implementing these programs. For example, the superintendent frequently attends new teacher trainings for these interventions. This shows that she supports it, and it also emphasizes to our educators that she's aware of the program material and finds great value in it being taught in our classrooms. Her presence goes a long way in assigning these programs as required school curriculum. For the sake of program fidelity, technical assistance is offered throughout the period of implementation. The Tooele CTC staff includes a full-time school programs coordinator. Part of her job is ensuring that all teachers are trained. She performs lesson observations in the classroom and also provides and gathers completed lesson-specific checklists. All of these things contribute to the process of evaluating whether the interventions are working as intended or if they're not. Next slide. Each year that we reviewed our approach and the preventive interventions being used, we are seeing successful results. Having the data to show these results to policymakers, funders, and key leaders is a vital piece in the puzzle of sustainability. It's important to be able to tie program results with program processes when asking for funding to not only continue with the chosen interventions, but also to fund the staff to coordinate the programs and maintain fidelity. The programs alone cost us approximately $10,000 per year per program. This amount, however, does not include the wages for a program coordinator. There's great value in having valid, accurate data to support your line item requests when creating an itemized, relevant budget. As each year goes by and we continue to show success and that we're approved through the budgeting process, the more institutionalized we become in our local government and their day-to-day operations as well as services offered. Next slide. Another essential piece of sustainability in the CTC framework is the relationships and rapport that are established with your community members, whether they're champions, your key leaders, coalition members, the folks implementing the programs, or the students and families who are receiving them. There's great value in meeting your audience where they gather. An example is attending city council meetings, even if CTC is not on the agenda. I was asked once about that, and my reply was, well, they support us in all that we do. We want to show support in what they do. With this process being data-driven, using an outside evaluator and analyzer for your student survey data is invaluable. You want to solicit evaluators that employ scientific methods and practices to compute the data with validity checks in place so that you can ensure honest student feedback. Another important thing is to rejuvenate your coalition and your work group members. We do this by providing structure and training about CTC. We offer term limits on our board. We hold consistent meetings and have activities and events. You also want to invest the time to uncover the individual talents of these members. You want to give them some skills, opportunities, and recognition to showcase their individual contributions and make their time feel worthwhile. Having an energetic chairperson is also a key to success for your coalition work. And be sure to invest in your messaging. If it's written material, use focus groups for diverse feedback. Perhaps if you have funding, there's an ad agency available, utilize them. Maybe one of your coalition members has experience in marketing. You also want to invest time in your spokespeople for your programs and campaigns. Be sure that they're provided the proper education, give them some grooming and practice, and this ensures that your message is being delivered with appropriate content and enthusiasm. Lastly, stay visible in your efforts and available in your conversations. Keep your leadership and audience engaged and aware of what CTC is doing in your community. Next slide. So thank you for your time and the opportunity to tell this brief story of Tooele Communities That Care. I hope I was able to answer some questions. I look forward to the Q&A portion of this webinar, and I hope that maybe I've inspired some of you to start this in your own communities.